He is also a co-founder and managing trustee of Mental Health Support Foundation. His belief that recovery is incomplete without assimilation back into society has made him launch another initiative, Let's Walk Together, that hopes to bridge the last mile by helping people with mental illness to work in whatever capacity they can. Please note, we are recording this talk so it can reach a larger audience. Now, without further ado, let me invite Vijay Nallawala to share his inspiring journey and insights with us. Over to you, Vijay.
Thank you so much. I think you have made me co-host, right? So if I may share my screen with you people, and if you could spotlight my video so that it doesn't keep switching on to other people who do not mute themselves. Is that possible for you to
Yes.
spotlight?
Yes. Have you shared your?
I'm sharing my screen as well. Yeah. Okay. Yeah. Okay. Yeah. Right.
Uh, Manjari, could you pin it to the top?
I think I have done that.
Sure.
Okay.
Can you see the screen?
Yes. Everybody, I think.
Right.
So
Thank you so much for this splendid opportunity. We have got a fine gathering today of over 60, 65 people. So that raises my enthusiasm to give my best for this conversation. So thank you, Ganesh, Manjiri, and Team Eklavya Foundation for this opportunity once again and inviting me for this webinar. Yeah. So the topic given to me was about how to recover to functionality, but I would rename it as recovery is a journey and not a destination. Yeah. Because we would all agree that it is a process through which we all evolve. There is no getting to from one point to another. It's a incremental kind of a process which we diligently must all follow.
Echoing.
Yeah.
Echo.
Could everyone please mute their mics while Vijay?
Mute.
Am I now audible?
Mr. Swami, could you please mute your mic, please? Yeah, please go on. I'm sorry about that, Vijay.
Not at all. Not at all. Thank you so much. So a little bit about my background before I dive into the presentation for today. I'm 62 now. I've lived with bipolar disorder for close to half a century by now because it began in my early adolescence. And due to the complete lack of awareness, psychoeducation, way back in the early 70s, we had no clue what I was living with. Nobody in my family had any indication. So the early symptoms must have begun when I was 13 or 14, and diagnosis happened a full 26 years later when I was age 40, when it was a full-blown manic episode, and it was very difficult for somebody to miss those symptoms. Yeah. So that is how long a gap that my diagnosis took place. Subsequent to my diagnosis also, it took quite a while to reach recovery because as everybody knows about this, the longer the gap between onset and when the diagnosis happens and the treatment begins, that helps. The shorter the gap helps in the recovery process in preventing the disorder from escalating, and the longer the gap, what it entails is multiple episodes happening in between in that duration, further internal changes happening within the brain, and the more difficult for it to pull back. So, in fact, I think that makes my story even more sort of, relatable to a lot of people who would, especially those people, some caregivers who also might have joined in, who feel that there is no hope in supporting their wards. I think recovery is possible in almost all cases. Yeah, we must hold on to that hope, right? So, what was the process of recovery that I pursued? I call it interestingly, the acronym ABCD, breaking it down into steps. Uh, So I think these are the stones of anybody's recovery journey. And what I will sort of elaborate on what I mean by what these particular aspects mean to me. So acceptance is layered. Acceptance is, I mean, we know it as a very broad term, but it firstly begins with, of course, accepting the diagnosis. We know of so many people who spend years and years together being in denial, not acknowledging they have a mental disorder, not acknowledging that they might need treatment and support in that area. There is a conflict between the person and family caregivers because they would want the person to be treated, uh, supported by therapy and so on, and then the person is not willing to because the lack of acknowledgement and acceptance of it. Further from there, I would say it goes much beyond that. And once one's acceptance increases, there is this internal realization that there is a strong need to be diligent in this process, to cooperate with other people, to follow the treatment and advice given by professionals. And then even moving further from the understanding and the coming to terms with that, okay, now I have a disability. There might be certain areas in life where I would be sort of curtailed. Aspirations would have it to be moderated accordingly, especially depending on which phase of your recovery path you are in, right? It is not a sort of a, broader kind of a limitation. I wouldn't want to get into that. And lastly, at a even broader level, is being comfortable with this new reality. Because we might acknowledge things, but are we comfortable with this harsh truth? It's not easy to move from that point A to B. All right. Coming to the B of the acronym ABCD, belief. I think this was very crucial for me to trust the process, continue doing what I was doing all these years. Because in my case, it took me close to a decade post diagnosis and treatment to come to a semblance of stability. Because the damage done till that time, because of the delayed diagnosis, made it a little more challenging for the treating psychiatrist. So, uh, at the core of my, internally, I believe that despite the circumstances seeming to be overwhelming at a particular point of time, there was a light at the end of the tunnel. Yeah. Even if the tunnel seemed endless, it seemed so dark and bleak that there was no escape in sight. But there was an inner voice within me which made me determined to keep going with the process, doing the things that would lead me to recovery. So, without that belief, I doubt whether I would have been motivated enough to diligently follow all the steps that I did in the process. And I'm a deeply spiritual person as well. So I think over out of this belief, and what would somebody would ascribe to as willpower to a higher power in my, who was guiding me all through this process. The C of ABCD is cooperation. we would all agree how important it is for the person to sometimes uh, well, be a part of the entire ecosystem, and the ecosystem could mean treating professionals, that would also include sometimes physicians, the therapists, family caregivers, in the terms of person like the workplace, colleagues and peers, and so on and so forth. Right? Very importantly, we can be in a phase of denial during an episode, whether it is mania, psychosis, and then not sort of agreeing to the treatment process or the plans that family might have for us. So resisting that would only extend damage to ourselves and lead to a lot of heartburn for family caregivers. For me, cooperation also means it's not only about receiving from all the wonderful caregivers that were there in my life, but also then being there for them. Okay, giving back to them in terms of gratitude, appreciation. I mean, smaller ways of life. I think this is fundamental to recovery. Discipline. Yeah. And especially in this sense, I would like to point out discipline in terms of a holistic health approach. A lot of mental health disorders and severe conditions are then reduced to a biomedical approach, and we know that the world is moving away from that approach to a more holistic approach, a more 360-degree approach, one would say. Yeah. And I will get into that, of course, a little bit in detail in the next slide. But prior to that, I would also like to broadly touch upon what discipline means to me. So for me, my discipline, especially in those years of struggle, was almost like somebody from the military, right? And people used to even make jokes about it, right? I mean, you are going to extreme lengths to be, the person you want to be. But I would spare no effort in that direction. So, I just give cite an example, okay, an anecdote. So here I've talked about avoidance of substance, and there are other things which could upset the apple cart, so to say. So I have quit alcohol from being a binge drinker to going to teetotaler overnight over 33 years ago, right? And not invite drink after that in all these years. So this kind of discipline has helped me, of course, with my mental health, my physical health, and that resolve. I know that I can sort of resist instant gratification and those kind of uh, impulsivity. Discipline also means that if I have chosen a path, these are the components that I am going to pursue. Understanding that it's not going to be a straight line. There will be those ups and downs in this on the path, and even then sticking to it. Right? Of course, we might want to modify certain elements along the way. That's different, but not jettisoning the process just because I'm not getting it. It's important to also reach out when we are somewhere, and that's bound to happen at various points in time. There will be places where we are either stuck in terms of our careers, relationships, in our own health regime, in any area. There are people who can guide us well. One can have a close circle of trusted friends and peers who we could reach out to in such a. In fact, I would recommend maintaining a diary of such people, because at that time we feel lost and our mind doesn't help us out. Right? So we can do that even when in doubt. We need guidance. For instance, I have five mentors in my life to share an example of what I do. If I'm launching a new project, or if I'm taking a major decision in my life, I sound out my mentors. And they know me so well, so they know what would resonate with me, the person I am, and whether that is the path which aligns with my individuality and whether I should pursue that path. And invariably, that advice has helped me, you move ahead in life. There was one slide which went back and forth, I think, yeah. And also part of recovery is getting the fundamentals right. So we might talk about the peripheral support to recovery, the model which I described. But at the core of treatment of any severe mental health condition, we have to acknowledge that psychiatric treatment is at the core of it. And I had the benefit of a fantastic psychiatrist who was very, competent, communicative, and caring. So that made me trust the process a lot. Uh, Mrinalini talked about the peer support work that Eklavya does. In fact, starting Bipolar India helped me in my own recovery process because learning from the stories of other peers, what they did in particular situations, what were their approaches, all this becomes a collective pool of knowledge, builds resilience collectively. I think that is a powerful mechanism that we often ignore in these conversations.
म्हणजे त्याचं परत ट्रान्सलेशन करता येतं ना. ते पुढे रेकॉर्ड होते काय नाही. हा पुढे रेकॉर्डिंग होते काय नाही.
Sorry about that. Ganesh also referred to our livelihoods initiative. It arose from the observation that being occupied in some way definitely helps with a person's recovery. And that is backed by research. In which areas would that be a contributing factor? Firstly, for a condition such as bipolar disorder, which I live with, and many of our community members also live with, it provides a structure, and structure is so important in facilitating recovery. Sense of self-worth. Don't we all crave for that? There are, of course, psychological benefits such as the sense of accomplishment that one feels after doing a good job, even at the end of a day at a workplace. And in the Indian context, isn't it an economic necessity for all of us, where we do not have adequate social support provided by the government? I had referred to a holistic health approach in the discipline part of my presentation, and I had promised that I would elaborate a bit about what were the elements that helped me in my recovery. And this goes beyond the medication and psychotherapy that which we may call as the default approach. So I also happen to live with a severe physical comorbidity and that also sort of the onset happened at a similar age of 13, 14. That was asthma, and it kept on getting worse and worse down the years until it became life-threatening and literally threatened my life on 2 or 3 occasions. So in order to deal with asthma, I had learned yoga. I was encouraged by my practitioner, my pulmonologist, and yoga and pranayama. I was also encouraged to do more of exercise to strengthen my lung power. All these practices which I had picked up then, I then sort of built on that to deal with my recovery from bipolar disorder. So I do pranayama on a regular basis. Mindfulness practice is something I really enjoy. It is a calming practice, and I hit the I hit the gym every day, at least 5 to 6 days a week for 1 hour a day, 1 hour a day. Today also was no exception to that. My wife and I consulted a nutritionist to get in place a diet considering especially in my case, the complexities of my conditions. If diet could help improve my energy levels, my fitness, and it did make a major difference. In fact, I would say nutrition is often undermined in these sort of discussions, and it needs to be spoken of much more. Sleep is critical to maintaining a sleep cycle, I would say, is critical to mood stability. Uh, because disruption in sleep timings, quantum of sleep is a precursor to episodes and also an indicator of an oncoming episode. So the more one adheres to sleep, discipline, it could lead to better stability along the way. There are various ways to express oneself. For me, it was writing. For some people, some others, it might be gardening, it might be cooking, or playing with pets. It could be anything. But for me, writing set me free. And as part of it, I used to also journal a lot. It helped develop self-awareness, increased my insight into my own condition, made me more watchful about my own thoughts. Structure to my days, I already spoke about what I do as a holistic health practice. And also since age of 19 till 62, I've been working, in some sort of a career or other, with the structure all through, even through all these ups and downs. Now, what are the signs that we need to be aware of or cautious of, where we feel that this can be indicators of some ominous episode to come, or and where we might need to alert professionals or family caregivers. I just spoke about sleep patterns. So during bipolar depressive episodes, there is typically a need for a higher need for sleep. A person might sleep for 10, 12 hours and even then not feel rested. And on the other hand, during hypomania or mania, even very little sleep, as little as a few hours, a couple of hours a day, and then the person might feel energetic right through the day afterwards. So those are big signs, the sleep patterns, especially when it is prolonged beyond a few low or excessive energy, very similar to sleep cycle. Very low energy indicates a depressive episode in all likelihood, unless there are some physical issues that can be ruled out. And excessive energy is again correlated with hypomania or mania. Similarly, I don't need to read out all of these, pointers on this slide: talkativeness, spending patterns, our inhibition, need to socialize, or uh, being completely cut off from society. All these are indicators which might be subtle at the initial stage, but when it is protracted, those are warning signs. Lack of confidence and drive could be a good indicator of a depressive episode, and excess of it then again to mania, points to mania, hypomania. Irritability and anxiousness are often missed because they could happen across the spectrum. Yeah, and so sometimes, in fact, in adolescents, depression first shows across as irritability and anxiousness, and might not, or anxiety also, and might not show across as classic symptoms of depression that we know of. When would I inform my family caregivers? So if I have not slept well for several days in a row, then I know that there is problem coming up, that this needs to be attended to. So I would either get in touch with inform my family members, or get in touch with my psychiatrist. I had mentioned about drastic changes in energy levels, either too high or low, which is again a fair enough indicator of episode happening. During depression or a bipolar depression in this case, the sense of helplessness, worthlessness, and hopelessness, the typical triad of major depressive episode happening. A trigger warning, but thoughts of suicide also. It could be passive ideation, thoughts of self-harm. So this is a big red flag, and needs to be brought to the notice of caregivers immediately. It's also important for me to inform and take into confidence family caregivers before I jump into any major decision, especially when I'm not in a stable frame of mind. So it could be about quitting a job, joining a job, launching a project, getting into a relationship. Right. Right. Let's realize that recovery is not a linear journey. Irrespective of whatever effort I might put in, there could be blips on the path, and we need to go along with the flow, keep following the processes, and knowing internally that the episode won't last forever. We'll be back to our best very soon also. So what are the minor symptoms that I might face in my even phase of remission? So what is remission firstly? Remission is the phase where I have, for instance, for the last 7 years, I've been free of any major episode. Okay, I'm on maintenance medicine, and so I hardly feel that I have bipolar disorder. That does not mean that I can afford to be overconfident or complacent, but so that is generally what remission looks like. But it does not mean remission means freedom from all symptoms altogether. So there will be some face symptoms, or the issues that a person can face, and typically these can look like brain fog, our cognitive dysfunction that we often talk about, especially after a protracted illness, that is so often talked about. The inability to concentrate, to make decisions, focus, distractibility, lack of energy, self-doubt, succumbing to emotions. So these can be the sort of traps also in a way, and also the symptoms that we face. But my learning over the years, and also not only from my own journey, but also from the journey of a lot of our peers, is over the years we develop a lot of insight, self-awareness, we develop coping mechanisms to deal with these issues. So what was maybe overwhelming for us, maybe the initial stages of the condition, becomes much more manageable going forward. So, what do I do when I face these issues? Firstly, it's sometimes important that acknowledge that I am fallible, that I will have issues once in a while. It's important to give myself space, not to consider myself to be superhuman, to be compassionate to myself. It's critical to do that. I think somebody's not muted yet.
Yeah, I have done that. I'm
Yeah,
sorry.
all right, no problem. No problems. I can understand. Yeah. Communication between the person, between the care providers, in be it mental health professionals, family, peers. It's so important in the whole process, isn't it? Yeah. Uh, and it can be a really key factor in with maintaining harmonious relationships, building trust, and making the whole thing smoother for everybody concerned. So for me, the key attributes for very good communication, especially in this context, are empathy. I mean, it all begins with empathy, isn't it? Right? Are we just going to be assuming things on a factual level, or are we hearing from listening in from a place of empathy? Good listening skills. Uh, Before jumping to suggesting a solution, if we could first listen out the person well enough, I think that's important. Clarity in what we want to communicate. I think that's also very important, which I mentioned in the last point, when we describe our symptoms. Because psychiatry, the way the being an abstract science, the whole judgment about how a person is doing at this particular time is based on how we narrate our symptoms, isn't it? Or we or our family caregivers do that for us in some cases. Yeah. So clarity of thought, of communication is important. Being respectful of at all times, although we might have differences of opinions, it's important to do that as well. And this is, you know, aren't we inundated with information, news in this internet era, social media, WhatsApp groups, and whatnot, right? And there will be divergent views, something that sort of can trigger us also at multiple times. So, uh, what are my hacks to sort of keep away from these kind of negative influences in my life? So, I try to keep a sharp focus on uh, what is my central objective. You know, at this point in time, or longer, or at a broader level, uh, negative thoughts might automatically flood my mind. Also, important to be an observer, understand what all these negative emotions are that emotions and thoughts are at that point of time, and then responding to them after analyzing those thoughts or inputs that have come to my mind. That's one of the important mm, ways that I deal with negativity in my life. Uh, Over and above that, it's important for me to hold on to an optimistic perspective in life. Yeah, that's very important to me because I think by nature I'm wired to be optimistic, uh, and especially the circumstances that I had to deal with. It suited me to be more optimistic than be pessimistic and to give into circumstances, of course, and that has held me in good stead. Uh, this is from my personal experience and my belief system and what I actually practice. Uh, I tend to be a person who values the small things that come in my way, yeah, the small graces of life. Yeah. And I think that I've received a lot of love, support in my hardest times. People continue to encourage me, nurture me at every juncture, right? So our not acknowledging that is our feeling to be gracious. And I think that also tends to give us more room for negativity because then we lose sight of what's going in our favor and only look at what's stacked against us. So, this was the title of my book, and it about summarizes what my life story has been actually, right? Uh, so, I would say I have always aspired to live a life which would go beyond, in my recovery journey, I mean, to go beyond stability and mere functionality. I wanted to live a full life and I've been very, very fortunate that I'm at this juncture able to do so. Right? So I would like to part with this thought. Thank you so much.
Thank you, Vijay ji. That was a good summation of what you went through and how you came out. I hope people have taken the insights you have offered and will apply them to their own condition. Now the floor is open for questions, and please put them in the chat box. Do not unmute and ask the question. Please put them in the chat box. And Manjiri, if you could read them out as and when they come in, it'll be helpful for us. Okay. Uh, there is a Manjiri, could you pick up the queries?
Yes. One question was, I have a query with bipolar condition. How severe was it?
Okay. Thank you for that question because I didn't go into the details of my story because I said, let me stick to the theme of the presentation today, yeah, what the audience was going to be eager to learn from. So it was bipolar disorder is like many disorders, is just in a spectrum. Right? It can be from a very mild level, which is okay, which is barely diagnosable sometimes, yeah, and passes off as major depressive disorder, and that's why often misdiagnosed as major depressive disorder as well. Okay, two severe phases where it could be bipolar type 1 typically. That's at the other end of the spectrum. And I am diagnosed with bipolar type 1, which in which has the full spectrum of mood episodes ranging from depression, normal mood phase, hypomania, and full-blown mania. So I've been also been hospitalized during my full-blown manic episode, and I have experienced psychosis on multiple occasions. Right. I also have comorbid OCD along with that is obsessive compulsive disorder along with it. So that complicates matters a little bit. But I think these are just labels. At the end of the day, we have inherent ability to overcome and manage these conditions to the best of our individual ability.
Okay.
Sir, second question was how the family contributed in your support.
Awesome question. So, as I said, I have a lot of reasons to be grateful for. I think family played a critical part in my recovery. I don't know where I would be today without their support way back in 2003 when I was diagnosed. Yeah, first diagnosed. All right. So, at that time, when they all seemed lost, that gentle arm around my shoulder, reassuring me that things would look up, that you are a person a person who is very resourceful. We have seen worse even before this. Uh, we are there with you in this path. Sometimes the words can be unsaid also, aren't they? It's not always what is said that matters. Then just being there for us is something that comes across with such power. And in fact, that became my power and my motivation to sort of then keep doing all I could towards recovery. So I am now married. I have a daughter, and prior to that, my elder sister was my caregiver before I was married. Right?
Thank you, sir. So the next question is about medicine. I'm going to club these two questions together.
Sure.
How can we reduce our medicine at the earliest? And second one is, do we have to take medicine lifelong? That's the one question somebody was asking.
Sure. Uh, Now there is, I won't, dive too much into the medicinal component of this, conversation because I'm not a mental health professional. But from what I know myself, I can say this, that in most cases, treatment for bipolar disorder is lifelong. Right? Yeah, there might be exceptions to this rule, but this is the by and large kind of a picture. Uh, So when can the medicines be reduced? Now, again, that is a question which should be left to the treating psychiatrist, the judgment of the psychiatrist. So I used to be on 10 to 12 different medicines, different medicines. So the number of the pills I used to take in a day for my mental health, right? And from that, it has tapered off to maybe one-fourth of the quantum at this moment. Yeah, I'm hardly on two medications now, and they too are at a sub-therapeutic dosage. But that I have not done of my free will. That has been a process in consultation with the psychiatrist as he feels confident about my recovery, my stability, and then the medicines are titrated accordingly, right? The titration of the dosage and the medicines happens as per the judgment of the psychiatrist. And I think I'm not a rebel in this regard. I would rather trust my psychiatrists, treating professionals, because they know a lot about my mental health, and I have an implicit trust in their judgment, if that answers the question.
Yes. So second, the next question was, how do you manage to stick to a routine when you had bad days? What motivates you to overcome the negative thoughts?
That's a great question. I think this is so important. So, in one of my slides, I mentioned that recovery is not a linear journey, and it is so even more important to stick to the discipline that we have agreed to internally. There is no force, nobody had forced me to adopt this life of discipline, but I have chosen this path. And then it's not always that I will be seeing the results. That despite that, I used to see relapses on and off. I used to plunge into depression. Uh, so I remember there were times where my psychiatrist himself felt that, Vijay, at this point of time, I do not expect you to go for long walks or do exercise. And then when I came back home, I used to question myself if I really want to come out of this episode. Uh, I need to push myself that much harder. Right? So there was that inner voice. And it's also about finding a balance. It's not that you go whole hog when the energy levels are so less, when your mind is totally sort of confounded from all directions. But I used to take small steps at that time. So maybe going for a 20-minute walk instead of the 1 hour walk or strenuous kind of exercise. So one can do things in an incremental manner. The other thing was for me that went for me, I think, which was instrumental in my recovery was uh, I was the sole breadwinner in the family for ever since age 19 till today. So that also became a motivating factor. Sometimes lack of a comfort zone, you can imagine, then I realized that there was nothing that I could fall back on. I had to show up, right, every single day of my life. And I think that was a positive factor in my life rather than something that I would consider as a burden or some negative aspect in uh, that help me keep focused.
So the next question is, journey starts from A, acceptance. How you overcome non-acceptance initially?
Well, honestly, it did begin with when I was lying in the hospital bed, looking at the ceiling, the dull gray ceiling. The first thought into my mind was, now I'm mentally ill and I'll be bracketed, and there will be facing a lot of stigma. So, so again, a correlating thought is. To me, recovery and the mental part of recovery can be broken down to these three, that transition between these three pillars, from being a victim to a survivor to a warrior. Yeah, all right. So I think at every given point of every person's recovery journey, I think we will all go across these phases, and it's also relevant to other areas of life, whether it be in our work or relationship. We'll play victim sometimes, we play survivor sometimes, and then we are warriors, isn't it? So acceptance, it did begin with victim mode, but I was very quick to adapt, sort of come to that understanding. Okay, let's face reality and get on with life. So And I would consider myself fortunate also that adjustment didn't take so long. I think within a few weeks I'd made that adjustment myself.
So the next question is, do you have the outbursts of illness in your life, and how did you manage them?
Meaning, is it referring to episodes? Can the questioner be clear about that? Uh, what does a person mean by outburst? Is it emotional outburst, or what would it be?
Yes, it's an emotional outburst.
Oh, certainly. So, in fact, it's also a little bit of correlation there. So, I had a major challenge with rage. I'm not talking about anger. This is about rage which goes out of control, which damages me as well as the person towards whom the rage is directed. And so this could also be called outburst, something which was beyond my control at that point of time. And I had to do a lot of inner work to sort of overcome that, to come to a place of calmness where, you know, it caused less damage to the person. And importantly, these kind of outbursts, emotional outbursts, also led to episodes in my case. Yeah, it often tends to. Okay, because that overload of emotions and not being able to process them leads to other whirlpool of negativity, and consequently it can lead to a onset of an episode, which was, and I was warned about that by my psychiatrist often.
So the next question was how to cope when having anxiety at workplace for few days, how to discuss management about certain disorder and still continue with the job.
Um, Great question. So, in fact, I have had to deal with this in my own work life. Although I have been self-employed, and that was the one advantage I have had. So I wasn't literally reporting to anybody, but I did face these issues of demotivation, lack of focus, anxiety, poor performance issues at certain points of time. uh, I think more than the individual, it needs a good workplace culture for such conversations to happen without fear. I think that is missing right at the moment in India. It's very difficult for a person to open up about mental health issues that he or she might be facing at the workplace because of the fear of stigma and discrimination, or looked at differently from the other colleagues. So at the Let's Walk Together Livelihoods initiative, for the candidates who we managed to place through our initiative, we want to do the hand-holding part for such candidates, so between the management and the person. So sort of if they are afraid of raising such conversations, if we could help them get that across and make it in a sort of a safe way for both parties. There also needs to be sensitization at workplace. That I think is also so important. Just creating awareness around mental disorders or what it does to people, how to support them is one thing, but the kind of language that needs to go around, what are the systems in place, how can workplaces be less toxic to people? I think those are the areas which so it's a very broad issue. It's not just limited to an individual's anxiety. Many times there are contributory factors to it, and the person is sort of completely overwhelmed by it.
Sir, I think you have answered this question partially.
Yeah.
But the question is, how do you manage to stick to a routine when you had bad days? What motivates you
Yeah.
to overcome the negative thoughts? I mean, you have answered this partially, but
Sure. So as I said, the other thing was, I did share a little bit about my asthma, living with severe asthma, and several specialists had given up hope on me. So the only thing that resurrected me from, a no hope, or as far as dealing with asthma was concerned, was my discipline. So when subsequently my bipolar disorder diagnosis happened, it wasn't very difficult for me to go back to that discipline, even if it was to deal with a different condition now. Okay, so inherently there was this belief in me that okay, there will be these rough days, there might be these dips in my, I might be completely lacking in energy, drive, belief, self-confidence, but I have the ability to overcome that and put in at least this much effort. I think the most important part in this kind of a disciplinary approach is consistency. I think I scored very high in consistency. It is not just the quantum of things we do, it's continuously being at it, not dropping out just because I'm amidst an episode. So, barring very exceptional circumstances, where I was completely down and out, I have not discarded my routines at all. Yeah. So it also came in, the motivation and the belief system came in from how I had overcome asthma also to a large extent. So I kept telling myself, if I could, if I was told that your case, I mean, I was literally told that I'll have to shift out of Mumbai, I will not survive a year, even a couple of years more. My asthma was getting, Mumbai being a coastal city. And I said, if I could have overcome that, there is a way I can overcome bipolar disorder also. That is what was my inner sort of conversation was. And then the motivation came in to keep doing, keep following the process. Yeah. Does that explain it further?
Yes, sir. Sir, I think this is for the audience. We won't be taking much questions about the medicines and what medicines or something related to treatment plan or the diagnostic part, because this is what we like Mr. Vijay also said, and we at the A level we believe that it is the decision of professionals, that is psychiatrist. He has to, your doctor has to take the decision about that. And there were few questions regarding how long we have to take medicines and something like that. So we won't be doing that, but this session is for to get the inspiration and what the things which are besides medicines and the therapies, but as his journey, how he has done certain things which we are still to understand or learn from him. So the question I'll ask is, besides medicine and family support, what else helped you to be at the pragmatic place you are in?
So, I would say having clear sort of objectives in my life.
Hmm.
Yeah. So I had said earlier that firstly earning an income every single month of my life, uh, post graduation days, that was a necessity for me. So that became an immediate objective. To be earning, I needed to be fit and stable also, right? So it's a sort of a circular kind of a process. So one thing keeps the other going. So then, if I want to be stable and functional, what do I do to be there? Okay. So having a long-term objective, and then I used to make plans for myself for a 3-year term plan, objective, 5-year term objective. Where do I see myself as? And that gave me the direction to move ahead in life. Other thing I would also like to mention here is during an adverse episode, it is sometimes very important to step back, not be overwhelmed with what we are seeing immediately in front of us, to step back and then look at the larger picture. If we look at the larger picture, it is easier for us to find ways to navigate a way around the obstacle that we are facing in the immediate, circumstance or environment.
Sir, looks like there are few questions about job related. If a person, one question is that I am thrown out of every job due to my lack of performance due to OCD and bipolar. What job you can suggest? Psychiatrist asked me to go to a stress-free job. And the second one is, it is difficult for a bipolar person to attend office at a fixed time. How do a bipolar person manage this difficulty? And is it right for employer to deny a job because of mental illness? So if we could answer this collectively, it will be better for you to, have this
Sure.
holistic answer.
So it's a bunch of questions actually. So let me try to do justice to this complex set of questions and which are very relevant also. Actually, very relevant questions. So answer to yes. Firstly, it is possible for a person with a bipolar disorder to attend a job and stick to regular timings. That is, there is no bar to that. Okay. It all stems from how stable and functional the person is. I think, of course, it hinges on that. A person who is in a severe episode, who is too much of a ask for that person to be expecting that person to put in 8 hours or 9 hours at the workplace, right? So it all. The more stable a person is, the more the possibility of sticking to a job. Second thing, uh, can a person be discriminated against because of their disability? In this case, the disability is an invisible disability, which is bipolar disorder or any other mental disorder. On paper, we know that the RPDA or the Rights of Persons with Disabilities Act talks a lot about non-discrimination for persons with disability. But what do we find in practice? There, especially in the private sector, there are cases where people have been sacked, not directly due to their prevalence of their mental disorders, but it could be on the grounds of non-performance or some other pretext. So there are very few safeguards that we are aware of at this juncture to sort of protect the person's rights at the workplace, yeah, especially in the private sector, which is profitable. Let's admit that. Yeah. The third part of it is the performance part. Now, since if we are talking about private enterprises, uh, we know that everything, the performance metrics drives everything. Let's be realistic. If I'm being paid a salary in whatever role that I'm doing, it is because I'm expected to give a particular work output to that company. If I'm not meeting even 50% or 60% of what is my role in that job, how am I going to expect the company to retain? So I think that is from the economic and practical perspective. Right. Have I answered all the three questions or have I missed out because there were multiple ones bunched together in one?
No, I think you have answered everything. And
And also, we also had conducted a series of sessions led by peer mentors for our own peers on the workplace mental health issues. And many of these things were discussed, these issues. And people who have aged their careers in the workplace, okay, and living with severe mental health conditions. So there are shining examples within our core team itself. So there is hope in that regard as well.
uh, sir, one question is, how could
Yeah.
I get the book in Ireland? Because some people from Ireland have joined us. So
So it's available on Amazon, and I personally feel that this is a dated book. It's been written a decade ago. A lot of water under the bridge. It's not a book that I recommend to anyone. Actually, if you ask me, I just brought it up as a visual, not as a plug or a promotion of my book. But the title of it, that from torment to the fulfillment part of it, that is literally how my journey has transpired. Yeah. So, in fact, I would not recommend it as an ideal reading for many people.
uh, I think we have to ask one question,
Yeah,
and it is related to medicine. And we have
yeah,
Dr. Arun Rukdikar with us, and
yeah.
he volunteered to answer that question because
Sure,
he's a
sure.
psychiatrist. And so the one thing, sir, I would like to ask Rukdikar sir is that it was about lithium. Okay, so there are lithium has side effects and it affects kidney. Let me find that question, but it was related to that, sir. So could you just answer that question, sir?
Sure. Thank you very much, Mr. Vijay Nallawala, for a
Thank
very
you, sir.
lucid presentation about
Thank you,
your
sir.
efforts to get over your problem and lead a life beyond functionality, beyond stability. So
Thank you,
it is
sir.
a great achievement altogether.
Thank you so much,
Lithium,
sir, for the appreciation.
lithium is a very, very excellent drug, and it is one of the best drugs that is available for bipolar disorder, and not only bipolar disorder, other types of mental disorders as well. For nearly 50 years, we have been using lithium, and we have used it for 8 to 9,000 patients of mood disorders so far. And true, it is a tricky drug, but the side effects, if you can keep the very close watch on the side effects, family members as well as patients, as well as psychiatrists who keep a very close watch and do periodical estimation for serum creatinine, urine routine examination, and other serum lithium level, sodium potassium level. It is a very, very safe drug. It is only if there is a dehydration.
मला हेच तुमचं आवडत नाही विलास मी मगाशीच विचारलं तू म्हणले की मी काय
Sorry, sir.
Can you hear me?
Yes, sir. Sir, there was a disturbance. Yes, sir.
Yeah. So if it is given carefully, it's very, very excellent drug. So this is the best drug that is available for bipolar disorder as well as many other mood disorders. And bipolar mood disorder is a much better problem to treat than schizophrenia. If God asks me to choose either schizophrenia or mood disorder, I will definitely choose mood disorder because that is the best, that is amenable to treatment, proper treatment. The problem comes when there is a misdiagnosis of schizophrenia. Many times, some of the psychotic symptoms in schizophrenia are seen in mood disorder. And many times, because psychiatrists do not spend enough time taking history, doing a detailed mental state examination, doing a physical examination, they miss it for the schizophrenic illness. And if the diagnosis is wrong, how treatment can be of benefit to the patient and to the family member. So I think the kidney scare, Dr. Morgan Cow, he was a Danish psychiatrist who popularized lithium all over the world. And according to he coined a term called kidney scare. And when he wrote a chapter on kidney, lithium and kidney in a book on lithium and kidney, which was edited by F.N. Johnson. So in that, he has coined a term called kidney scare. He feels that we are unnecessarily worried about kidney scare. Kidney can get affected by other medical conditions like hypertension, diabetes, renal stones, and other medical conditions that by lithium itself. It is true that after many years of lithium therapy, there may be little polyuria or passing excessive urine, dilute urine, so on and so forth. something like a diabetes insipidus. But before that happens, if you monitor serum creatinine level, urine routine examination, and sodium, potassium, and lithium levels in the blood, there should be not much of a problem. And even Vogel's cow and per Westergaard, they have recommended every 3 months you should do this thing. On every visit, you should do these tests and physical examination for the patient. And with so many, our experience with 8 to 9,000 patients over the last 50 years with lithium therapy, we have found very few who had real complications. I remember only 4 patients who had real toxicity with lithium out of so many patients. So lithium is a relatively good drug. The other question is it recovery possible without medicine? When such a good medicine is available for the control of the bipolarity, both poles of depression as well as hypomania or mania, why not use lithium? And patient's effort is equally important, as well as the effort of the family member to understand the nature of the illness and understand what is the basis of causes of the mental illness and how it should be treated, what is their role in the treatment. And unless patient as well as family members take active part in the treatment, only medicines are not going to help. Another question is, can medicines by themselves without any other belief bring it stability? No, medicine alone cannot do the trick. Patient's effort, patient's positivity, family members' positivity, their own efforts are equally important. Another question is, do psychiatrists fail sometimes? Yes, many times psychiatrists fail because they don't spend adequate time diagnosing the patient and they misdiagnose the patient. They spend 2 minutes or 3 minutes or 5 minutes or even 10 minutes with each patient. So that's not adequate to arrive at a correct diagnosis. So naturally, psychiatrists do fail. So unless we do our textbook practice of psychiatry, psychiatry remains only the first stage. And it is unfortunate many psychiatrists mistake first aid to full treatment. First aid is just for temporary period. Say for instance, if you have a fracture, you tie a splint so that there is no movement of the bone. But that is a temporary measure and not a permanent measure. So similarly, full psychiatric treatment is essential, including quite a lot of psychotherapeutic help, counseling to the patient, counseling to the family members, counseling to the community. This is also very, very important that community should understand what is the nature of the illness, and they should be able to detect these symptoms in the people in the community.
Yes. Sir,
I think that answers some of the questions on medicine. If there are any
Yes.
other questions, I'll be happy to.
Sir, what we will do, I can see few questions, but I think these questions, to answer these questions, Dr. Rukdikar needs a full information about the patient. So I have put this Eklavya Foundation mh@gmail.com, our email ID in the chat box. Please write it down. You can send your question and we will be happy to forward this question to. There are few questions to Mr. Vijay Nallawala as well as to Dr. Rukdikar. So we'll be really happy to do that. And almost we are running short of time. So I'll just, Ganeshji, over to you. Please do the vote of thanks.
Thank you so much, Vijay ji, and Arunji for Lukadikarji for chipping in, and it's been an eye-opening, very informative session, and I thank from the bottom of my heart people who have come here with hope, and I hope that they will return with some answers and be able to apply it to their own situations, which and the circumstances which will be similar or close to what we have talked about. Thank you so much, and sorry for the overrun. I really appreciate your patience, Vijay. Thank you so much, and we'll hopefully catch up again with some other occasion. In fact, I think Dr. Arun Rukdikar should give us a talk sometime, and I think we should also acknowledge that. Well, in conclusion, thank you, all of you, and have a great remaining rest of the day. We'll be there for you in support groups, which are in English and Marathi so far. Thank you so much. Bye now.
Thank you.
Thank you, sir.
Thank you, Ganesh.
Thank
Thank
you.
you, Eklavya Foundation, and thank you,
Thank
Dr. Arun Rukdikar.
Thank you.
Thank
Thank you,
you.
sir.
And thank you for the audience for the amazing interaction. Appreciated that.
Mhm.
Thank you.
Thank you.
Thank you.